What's up guys, and welcome back to my YouTube channel. Okay, and today's topic is going to be about diabetes. Okay, in this video we are going to understand what is this diabetes, types of diabetes, causes of diabetes, some signs and symptoms of diabetes, and how it can complicate the entire body. Okay, and treatment, or how you can manage or control or prevent diabetes. Okay, so as we all know that diabetes is among the diseases that are increasing mortality rate, not only in Africa but worldwide. Okay, so let's get to it. What is diabetes? Diabetes is a metabolism disease that increases blood sugar, and this can occur when we have insulin resistance, or the body is not able to make enough insulin to produce insulin. Okay, so we have different types of diabetes. We have pre-diabetes. This is where there is increased blood sugar, but it does not meet other criteria to be called diabetes. Okay, we call it pre-diabetes. Then we have type 1 diabetes. Number 3, we have type 2 diabetes. Number 4, we have gestational diabetes. Okay, so causes depend with type. So under type 1 diabetes, the causes is unknown, so it stands as autoimmune condition. The body tend to attack its own. Okay, and type 2, it's mostly lifestyle, the food we eat, then overweight. You see, sometimes it's genetic, the causes of type 2. And the causes of gestational, this is only when you get pregnant and there is hormonal changes, so it interferes with insulin production because you're gaining weight, and this interferes with production of insulin, so you may tend to have high blood sugar during pregnancy, but 6 weeks postpartum it get resolved. Hope you understand that there. Okay, so we have different signs and symptoms of diabetes. Blood vision, or you're having problem with seeing, you feel hungry every time, you feel thirst every time, you go to urinate every time, you have sores or wounds that are not healing. And for men, they end up having, or they start having erectile dysfunction. This among causes of diabetes, or signs and symptoms of diabetes. Okay, take note if you are experiencing this. I insist on erectile dysfunction. Another signs and symptom is, for ladies, you tend to have yeast infection and this current or UTI infection. Okay, urinary tract infection. Sometimes you tend to have dry and itchy skin. All of these are signs and symptoms of diabetes. Hope you have understood up there. Okay, and as I say that these conditions affect the entire body. Okay, that's why we are saying it affects the eye, the urine, the bladder, the skin. Sometimes you tend to have headache, like the entire body. So the complication of this condition, it affects every organ of the body. Okay, so some of the complications are, you may end up having high blood pressure, heart attack or stroke, sometimes neuropathy, nephropathy, blood vision, like completely blood, you can't see clear. Okay, sometimes you may have to have depression or dementia, and worst of this complication is hypoglycemia. And signs of hypoglycemia is confusion, fainting, okay, or dizziness. This is very dangerous. It's better to have hyperglycemia, high blood sugar, than hypo. This is where we have very low blood sugar in the system. This is dangerous. If you start seeing dizziness, you feel confused, sometimes you faint, please take care, go to the nearest hospital, get checked. This is dangerous, okay? So let's understand some of things that you can do to prevent diabetes or to manage diabetes. One of all is when you are obese or you are gaining weight so fast, you need to do exercise, lose weight, avoid junk food that increase blood sugar, okay? And this give me another thing. So the next video I will be talking about the food that you should consider when you are diabetic, okay? So, but the best thing is to lose weight, do exercise regularly, like daily, okay? So apart from doing exercise and eating healthy, the one thing that you should do is emotional management, okay? Because when you are stressed, you tend to increase cortisol hormone, and this cortisol hormone interfere with production of insulin, okay? Stress management or emotional management, okay? And last but not the least is routine checkup. Consider all these 4 things and you're good to go. If you're not yet diabetic, you will be able to prevent it. Bye. See you in the next video.